The next section will discuss patient and family goals, including what they are, when to have certain conversations, tips for setting goals, and assessing your goals.
Hi all, and welcome to Part 3, Patient and Caregiver Goals. My name is Catherine Pinney, and I am a Public Policy Intern at Retire Safe. I'd first like to commend the National Grange and Retire Safe for the collaboration and success of this webinar series. I'll begin today by breaking down this PowerPoint into 3 main sections: the creation of goals, the implementation of them, and the success of them. But first, what are they? They are a collective understanding of patients' diagnosis, care, and treatment goals, which is crucial to the best possible care. Your final goals could be to completely cure the cancer, to keep it from worsening, or to ensure the best possible quality of life for the patient. The discussion of your goals of care should occur early and often with all parties involved in this process. Early discussion can help doctors to better recommend treatments to a patient's unique situation, which improves satisfaction and the quality of care. A treatment plan specialized for the patient will be able to greatly reduce stress on family, caregivers, and certainly the patient themselves. You may find it beneficial to reach out to survivor groups, as their knowledge may help you choose what will work best for you. I'd like to emphasize that these conversations will not reduce hope. They also should not occur only in conflict or during disagreements. How do you create these goals? When setting and implementing your goals, it's extremely important to be patient with yourselves. Success will be an uphill fight at times. There may be moments in which you find yourself farther away from your goal than you did the day before. Start small by creating daily tasks to work yourself through larger goals. Celebrate the patient, caregiver, and doctor's efforts, not just the accomplishments. Realize that your goals may change over time and be flexible to these changes. I'd like to introduce you to the SMART goal model. SMART is an acronym that you can use to guide your goal setting. To make sure your goals are clear and reachable, each one should be specific, measurable, achievable, relevant, and time-bound. A specific goal is simple, sensible, and significant. A measurable goal is meaningful and motivating. An achievable is agreed and attainable. A relevant goal is reasonable, realistic, and results-based. A time-bound goal is time-limited and time-sensitive. Some questions to ask yourselves when setting these goals. Who must be involved in the process towards this goal? What does the patient, doctor, and/or caregiver want to accomplish? Which aspects of the patient's reality must be considered? It's okay to examine the physical and emotional costs of your goals, as well as possible financial limitations, accessibility to treatment centers, and other factors which may affect your goals. When will the goal be accomplished? Why does the patient, doctor and or caregiver want to accomplish this goal, and how will progress and attainment of the outcome be measured? It's important to know that the success of these goals will be different depending on what the caregivers and patients would like. There are many different ways to track your progress toward your goals. I'd like to next introduce the implementation and progress of goals. Take the time to reflect upon your goals and imagine what the big picture looks like. It's important for you to see the bigger picture rather than just living day to day with no direction or motivation. When it comes to tracking your progress toward your goals, planning and organizing your time is key to accomplishing your goals. Once you are clear with the big picture, you must now plan and organize the necessary steps that you need in order to accomplish your goals. Share your goals with your spouse or a good friend. It's important to have another person ask you about your progress. When there is someone else other than yourself holding you accountable, you are more likely to get your tasks completed throughout the week. Questions to ask yourself to assess the goals you've set are: is it financially doable? Is it the right time? Have you got enough energy to achieve this goal? And how happy will attaining the goal make you feel? With each accomplishment, it's important for you to take a step back and to celebrate your success. If you are constantly looking ahead and never taking time to celebrate your accomplishments, you will most likely get burnt out. When you get burnt out, you lose the motivation to stay focused on your goals. Your success of your goals of treatment will look different for each individual situation. It could be that the known tumors are eradicated entirely, or that the recurrence and or spread of the primary cancer has been prevented. Or success could be that the symptoms have been relieved if a cure. I'd like to conclude this presentation by re-emphasizing the importance of goals. Having discussions about prognosis and goals of care with all parties involved, patients, doctors, and or caregivers, will facilitate advanced care planning, improve satisfaction with end-of-life care, and reduce the use of possibly inappropriate life-sustaining therapies. Thank you for your time today. I hope you take the time to listen to the other PowerPoints in this series to best prepare you in case you may need these resources. And a large thank you to Bristol Myers Squibb, the National Grange, and Retire Safe for helping with the creation of this program.